Well, September is Blood Cancer Awareness Month. Colorado Blood Cancer Institute, the region's largest blood cancer program. Joining me now is Dr. Gregory, a hematologist and oncologist with the Institute. Thanks so much for your time today. We really appreciate it.
Oh, thanks for having me.
So for people who don't know, how common is blood cancer?
So blood cancer, in terms of cancers, it's not the most common type. The most commons are going to be breast, lung, and colon. But after that, we do start to see more blood cancers like the lymphomas, multiple myeloma, and then leukemias. So they're not the first up that we think of, but definitely we see it a lot in our aging population. Blood cancers are going to occur more often in people who are 65 years of age and older.
And I'm sure once people learn about it, the second question is usually, what are the signs and symptoms of it?
Exactly right. When we think about blood cancers, we break them into two groups. We think about acute, which means that they developed fast, they happened fast. Those cancers make people feel sick pretty quickly within a period of a couple weeks of developing that cancer. So we see a lot of weight loss. And we're talking like we dropped 30 pounds in a month. So not like I've been trying to exercise and it's slowly coming off. A lot of night sweats. I know a lot of people sweat at night, but this is like drenching sweats, have to wake, your partner up and say, hey, we got to change the sheets. This bed is so soaked. And then a lot of fatigue. And I know a lot of us are tired running around and work and kids and all those things. But we're talking about normally I could go out and garden and now I just can't even get off the couch to go garden. I couldn't get a shower today. I was so fatigued. So those are those big symptoms. On the other side of things, we have what we call more indolent, or that means slow growing blood cancers. And so those ones are a little bit more insidious. They build over years and years and years. And often they don't show up until they start to hurt one of our other organs, like our kidneys or that sort of thing. And those are the cancers that are oftentimes picked up by really good primary care doctors who are keeping an eye on things.
So who is most at risk for this?
It's generally speaking going to be older people, age of 65 and up. And based on the different types of cancers, generally speaking, it's more common in men.
And is there a primary treatment when it comes to this?
That's a great question. It totally depends on the cancer. So based on what cancer you have, if it's a leukemia and the different type of cell that cancer was growing with, and even within the cancers themselves, we really change those treatments up and make them very specific. We've come so far with cancer therapies in general that a lot of these therapies are tailored exactly to what that patient's dealing with. So it's not so much a one size fits all anymore. Some treatments have to be done in the hospital still, but a lot of treatments are available in the clinic, and so many in pill form, where you just take your pill every day, and things are pretty well managed.
Well, in just these few minutes, I think we've all learned a lot more. So thank you so much for your time today. We appreciate it.
Thanks for having me.
All right, take care.
Bye.
And you can watch all of our health interviews right now on CBSColorado.com.